Well, hello and welcome. For those who I have not yet had the chance to meet, I'm Dr. Richard Nongard with Peachtree Professional Education. And I'm very happy that you have decided to participate in this therapeutic homework resource program. This course provides you an opportunity to really have two things. First, a course approved for 3 hours of continuing education credit, as well as 5 specific resources, homework assignments if you will, that you will be able to access and utilize with the clients who you work with. I've been working with both adults and adolescents since the late 1980s. The materials that I have provided in this course are appropriate with both adult and adolescent clients. I wrote my first therapeutic workbook, I think it was probably about 1992. I was working as a substance abuse counselor at a halfway house in Houston, Texas. And many of the clients who I was working with were younger, and they were in treatment because they were addicted to drugs, and they really did not relate to the Alcoholics Anonymous textbook. So I created a step workbook back in 1992 that utilized the Narcotics Anonymous, the NA book, for the first 3 steps. And I've been using therapeutic homework assignments between sessions with almost all of my clients, no matter what the treatment setting, really ever since then. Today I actually specialize primarily in bariatric counseling. Many of the clients who I work with, they're 400 pounds, they're 48 years old, they've been ruled out for whatever reason as a candidate for bariatric surgery, and they come into my office depressed. I'm their last hope. They weigh 400 pounds or 48 years of age, and unless they lose half their body weight in the next 18 to 24 months, they're probably going to die as a result of their health condition. Those clients are clients who I want to keep focused on the task of recovery between sessions, and I give therapeutic assignments certainly to those clients as well. Although I'm no longer providing drug and alcohol counseling, I treat an addiction that I think is important to treat on a regular basis in my office. I probably devote about 30%, 40% of my practice to working with cigarette smokers in the field of smoking cessation. Of course, when my clients come to see me, in many cases they are sort of at their wits' end. They're desperate to find a solution. They've probably tried everything else, and they call me up, and I'm probably the therapist of last resort for many of them. Just a couple of weeks ago, this is actually my office where I really see clients. Just a couple of weeks ago, I had a client come in. He was sitting right here in this chair in front of my desk, and he, because of his diabetes, had an amputation. He had an amputation of some fingers, and it was not healing. It was not healing properly because oxygen wasn't able to get to his extremities because he was continued to smoke. And the doctor had told him, if you continue to smoke, you're not going to heal. You're going to end up dying as a result. He came in my office. He was desperate for relief, and I was able to provide interventions with him. He left my office a non-smoker. I followed him up 2 days later, as I do with all of my smokers. I continued to follow him for a couple of weeks, and I was able to address a number of different issues with him, and he was successful at smoking cessation. The way I structured my services, though, included daily homework assignments, not only to keep him on task, but also to help him experience relief from any symptoms associated with withdrawal that he may have experienced. I also work with a lot of clients in the area of pre-surgical preparation. A lot of clients come to see me, and they're experiencing stress and anxiety about their health and medical conditions. Just 2 individuals who I worked with in the past week, both of them were surprised by a diagnosis of breast cancer. One was 44 years of age, one was 71 years of age. Both of them had been told, you're going to be having a double mastectomy here within the next 10 days or so. There's not a lot of time to work with clients between my first contact with them and that day of surgery. And of course, this is a major and significant life change for them, and so there are many other tasks to accomplish. So by providing short therapeutic assignments between my sessions with them to prepare them for the surgical processes and the recovery afterwards, I think homework assignments are absolutely essential. In couples counseling, the couples who I work with are successful when they're able to have enjoyable and useful homework assignments given to them between sessions. Every one of the clients who I work with leaves my office with homework assignments. Now, virtually every prominent writer in the field of psychology in the last 20 or 30 years has advocated homework. The disagreement is on what we call it. Albert Ellis, of course, called it homework, the architect, I suppose, of cognitive behavioral therapy, or more specifically, rational emotive behavior therapy. Lazarus, on the other hand, has a disdain for the word homework, thinking that it is associated too often with the idea of schoolwork, which could be off-putting to some clients. He calls it instead empowering assignments. I don't really care what you call it. I tend to call it homework. You can label it whatever you want to. We can all probably agree, though, that no matter what label we utilize, giving clients, especially in the era of managed care, limited time and limited resources, things that they can do between sessions to learn specific skills that will empower them to be successful is really one of the, I think, foundations of effective counseling. This course provides you with a number of different resource materials. All of the components of this course can be accessed online. There is, of course, this teaching section or this lecture designed for you, the therapist. And this is, of course, going to be the foundation of the continuing education credit. There is an online access section for clients, and this consists of 5 different sections, each containing 2 things: a short video teaching a specific skill or strategy, explained in plain English so that clients can understand, even at a very basic level, why the assignment is given and what the value to them is for the assignment. Each assignment also includes each of these 5 areas also includes a downloadable MP3 that focuses on teaching the client how to practice those daily skills. These are very short. I think the shortest one is about 3 minutes, but I've tried to keep them between 3 and 10 minutes long. And the reason why is simple. I have found that if I give clients an overwhelming amount of homework, they simply do not do those things. They don't dedicate the time to it. And I want to prescribe for my clients homework that they're actually going to engage in and that they're going to complete. So these MP3 files are very short, and they're simply a process of engaging the client in the daily homework assignments. Now, one of the other things I think that's important is because these MP3s are downloadable, they can use them, clients can, online in our resource center, or they can download them to a telephone, or a lot of people listen to their MP3s on their phone, I do, or an MP3 player, or really any other device. What this does is it gives them portability for their daily homework assignment. This enhances the success. Now, there are lots of other formats that we could prescribe homework in. We could prescribe written assignments, we could prescribe tasks that they engage in with other people, etc. And those are all fine homework assignments. In this particular course, so I've provided 5 lessons with 5 teaching videos for clients, patient education materials, and I've provided the 5 MP3s that clients can access and download to really any device so that they can utilize this anywhere. They could utilize it in their office. They could utilize these assignments at home. They could utilize these assignments sitting in a park, wherever they are. Hay and Kinnear wrote a great book about therapeutic homework. And here's what they said, based on their research. Using homework as an adjunct to the work that occurs in the counseling session has been shown by the research to be an effective way to promote therapeutic change in a brief period of time. Increasing the relevance of homework assignments increases the likelihood of compliance and the effectiveness of the between session tasks. One of the important features of the videos and the downloadable MP3s is that these have been put online on our webpage in a client resource area. And you, as a therapist, will be provided a link and a password that you can give to the clients who you work with. Essentially, they will all be able to download this anonymously without having to register or provide any personal information to us. Additionally, I want you to know that these videos have been prepared focusing on skills development. There is not a particular theory or a particular therapeutic philosophy that is required to participate in these. They are intentionally non-controversial. They are based on evidence-based treatment protocols and are designed to be easy to view and easy to follow. You will have, as a professional who has purchased this course, you'll have a license to share these resources with the clients who you provide care to. You can choose to assign some or all of the assignments, and you can choose how your clients or how you will structure the implementation of the homework assignments or the daily tasks with your clients. So this program is totally flexible and totally adaptable based on the unique needs that you have. This program does award 3 hours of continuing education credit. In fact, right below this video, you'll actually find a link to a verification of your participation. When you complete that link and answer, I think there's 7 or 8 questions there, it will automatically generate a CEU certificate to your email box. Now, I recognize that some people will have questions about the process, about the course materials, etc. And I want to make you aware of a tremendous resource for you. We have a closed group on Facebook of mental health professionals. I'm on this forum every day, as well as hundreds of other licensed mental health professionals, social workers, psychologists, marriage and family therapists, addiction professionals, licensed mental health counselors, LPCs, etc. And you can find that group on Facebook by just going to the search bar and typing in LPC, LMFT, and social work group. You can also find it by going to www.changeworkforum.com. That'll take you directly to that Facebook page. So if you're a member of Facebook, as about 85% of us are, you'll be able to ask me or anyone else any questions. If you're not a Facebook user, feel free to email me at any time, or Stephanie in our office, and we will be more than happy to answer any questions for you. After you successfully view this course, as well as view the 5 videos that are part of the patient education section, as well as listen to the MP3s, you can then complete that link below. That will take you about 3 hours of time, and you will earn a 3-hour CEU certificate for participating in this course and in this program. Sometimes people ask me, why give homework? Well, we know that the research tells us that when we utilize homework assignments with clients, or whatever you would like to call it, I'm going to use the word homework throughout the videos, but you can feel free to rename it whatever you would like to. We know that the research shows us that people are more likely to make change, and they're more likely to make and engage in change quicker. That's what the research shows us when it comes to therapeutic assignments. One of the other reasons, and actually one of the primary reasons why I love using homework assignments, is that it structures therapy sessions. It really keeps therapy sessions focused on the tasks that need to be completed. When a client comes in for a second or third or fourth session, I can review those homework assignments with the client. It lets me know if they have not engaged in the process and there's resistance in counseling, then I can use therapeutic methods to address resistance in counseling, or it lets me know if they have engaged but they've had new difficulties that they were even unaware of that have emerged, which of course I can then incorporate into my treatment planning process. Or it lets me know if my clients have been able to make success. And one of the great things about effective counseling is that clients make significant changes. And we're often the person who is present to ratify that for them. Therapy, at least in my office, is a joyful process. It's a joyful process because my clients are making significant changes, and I get to share in those changes with them. I think one of the primary reasons why is because I use homework assignments with almost all of my clients. Now, Hay and Kinney in their textbook, they address reasons for non-compliance. And their list in their textbook, 5 different reasons why clients might not be compliant with homework assignments that are given, I think are worthy of discussion. And the first is that the client primarily wants to use counseling as a place to ventilate emotions or to rent essentially a friend or a sympathetic ear to talk to, but they're not really desirous of making significant changes. And there certainly are some clients who are resistant to doing homework because it would actually require making significant changes, and that's really not why they came to counseling in the first place. Now, the second reason why clients might be resistant to doing homework assignments is they don't want to take personal responsibility to do the work necessary to make a change. Instead, preferring to be passive and hope that somebody else makes the change for them. I cannot quit smoking for anybody else. Probably the most dramatic example here of number two that's come in my office was a few years back. A guy came in my office and he had a hard time getting in the door because he was dragging his oxygen tank behind me, and he sat in the chair here and he sat down and he was completely winded from taking the elevator up to the 6th floor. And he sat here in the desk and he sat down, and with the small voice that he had remaining, he introduced himself to me, and this guy was in bad shape. And I said, wow, I'm really glad that you're here. He said, so am I. He said a couple years ago he had quadruple bypass surgery. He had a previous history of heart attack. He was now 58 years of age. By the way, he looked like he was 88 years of age. He was 58 years of age. His skin looked awful and not getting any oxygen to the cells. And he said, my doctor told me, 4 years ago when I had the quadruple bypass, if I didn't quit smoking, I was going to die. And I came here because I got to quit smoking. I said, wow, I'm really glad that you're here. This is the right place. And so I was very empathetic towards him. In fact, I was really happy to see that somebody who appeared so motivated, even though he obviously had experienced a tremendous amount of difficulties to this point, was still willing to even come to my office. So I gave him the full benefit of the doubt. And we talked a little bit about the cues that preceded him smoking when he had previously tried to quit smoking. And the biggest cue for him, he owned his own company, was when he would be stressed at work and he would sit down in the chair at his desk. For him, that was the cue. And then he would just sit at his desk and chain smoke all day long. And he was the one who noted, when I sit in my chair when I'm stressed, that was his language. So in our session, I developed a specific homework assignment for him so that every time he sat in the chair, he would notice his stress level and he would engage in a specific short 30-second mindfulness exercise to focus on the present and relieve stress. In fact, I gave him a short recording. I love the use of MP3s. I actually recorded it in my office and sent it to him via email to his phone, so he would always have it with him. And it was about a 50-second assignment. And I said, when you sit at your desk, if you're feeling any stress, check on a Likert scale. What's your stress level? 2, 3, 4, 5, 6, 7, 8, 9, 10. Just take a moment, turn on that MP3 before you have a cigarette. That's the key, before you have a cigarette. He said, okay, I can do that. I'm willing to do that. So I worked with him, and 3 days later, I usually schedule for my smokers a second session 2 or 3 days later, because that's when they tend to have the most difficulty. And he looked awful when he came in the door. And he smelled like smoke when he came in the door. And he sat down in the chair and said, well, your counseling didn't work. I said, and how did it not work? He said, well, I've been smoking for the last 48 hours. I remember this was the third day. I said, so you didn't smoke for the first 24 hours? He said, no. He said, I made it a day, but then I sat at my desk, I was stressed out, and I asked somebody in my office for a cigarette, and I've been smoking again, just 3 packs a day, just like I have for the last 40 years. And he said, it just didn't work. So I said to him, well, let me ask you, you said you noticed you were stressed, you went in your office, you sat down at the desk. Did you listen to the MP3 I created for you. No, I was too stressed for that. We have to recognize in counseling, even though for many of our clients, the issues that we are working with are actually life and death issues, that some people will choose to die. This particular client was one who did not want to take personal responsibility to do the work necessary to make change. Instead, hoping that I was a magician rather than a clinician, and that I would be doing something to him rather than doing something with him. And that was evidenced by him not choosing to do the homework assignment I had specifically prepared for him. Now, he's the exception rather than the rule. The vast majority of clients who come to see me do their homework assignments because I try to make them as simple as possible. As a matter of fact, almost all of my clients are blown away by how helpful it was. I do a homework assignment with some of my clients where they touch their fingers together. It becomes an anchor, and they anchor a resource state. It's a real simple, real quick homework assignment that I do with some of my clients. And I have clients who come in for their second or third session and say, wow, I've been touching my fingers together, and it's amazing that something so simple really works. Or I'll have clients who come in to say, I've listened to the 2-minute mindfulness session that you prepared, that you sent me via email. I've been listening to it on my computer, I've been listening to it on the phone, and it's just incredible. In less than a week, I have decreased my level of anxiety. So the vast majority of my clients do their homework assignments. But these are some of the reasons why people don't. And the third reason that Hay and Kinnear give us is that a client is being forced to attend counseling, a judge, a mother, a spouse, etc. And therefore they're resentful of the process or they're rebellious of the process. And by not doing the homework assignments, they are actually manifesting that resistance in the form of resentfulness or rebellion. If we're dealing with adolescents, this is something that is very common as well. By the way, the adolescents who I work with love the MP3 homework assignments I give them. The fourth reason from Hay and Kinnear that clients don't participate in homework assignments is that a client feels that he or she doesn't have the time or the energy to complete homework tasks. For this reason, I try to keep all of the actual tasks very short and very brief. Quick exercises and things that they can either do or listen to. Like I said, all 5 of the homework assignments that are included in this course are really between, I think, 2 minutes and 58 seconds and 8 minutes. So they're really short, really brief. They're designed to enhance and teach a specific skill to clients on a daily basis between now and the next session. Now, I do ask my clients to do almost all of their homework assignments on a daily basis. Again, I've kept them short so they can do that. I am certainly not judgmental, though, when my client comes in and says to me, well, I didn't do it every day, but I did it 3 or 4 days, or I forgot to do it the first day or two, but I have done it the last day or two. That's okay with me. There's certainly flexibility and latitude here. I want my clients to begin to engage in it. Now, the 5th reason why clients don't do their homework is often related to us. The instructions are unclear or not specific enough, there's ambiguity, or we've been either negligent or inconsistent in following up on the completion of assignments. So if we assign a client to do homework, but then we don't ask in the next session about whether or not they've done that, that decreases our client's compliance with the next homework task or the next homework assignment. The research shows that when we assign homework, we need to follow up on that homework for it to have impact and efficacy in the counseling process. Now, this program has 5 specific homework assignments, and those 5 homework assignments are: number 1, or we'll call it week 1, a basic practice in mindfulness. Mindfulness is about staying focused on the present. This is a particularly useful strategy to my clients who are experiencing anxiety. Week 2, or the second assignment, focuses on therapeutic relaxation training. I use a number of different methods for therapeutic relaxation training, probably some methods that you're familiar with already. You may even utilize them in your office. whether it's progressive muscle relaxation or autogenic training or creative visualization. Chances are pretty good what you don't have is a short. You might have a 30-minute or 40-minute CD you could give your clients with all 16 muscle groups from Jacobson's progressive muscle relaxation, but you probably don't have a short MP3 you can give them. The reality is our clients aren't going to take 40 minutes a day to tense and relax the muscles. And so the question is there a better way to make this MP3 a sound file that clients are more likely to complete? And the MP3 that I've provided with week 2, I'm just calling it week 2, focuses on therapeutic relaxation training exercises, but it does it in a very brief time period. The third lesson, or the third week, focuses on emotional intelligence. Now, there are a lot of different aspects of emotional intelligence. The one I focus on in this particular course is developing resourceful emotions. We often think of emotional intelligence as not doing something that is unhealthy or harmful to us. Not being depressed, not being anxious, not being angry. But really, emotional intelligence isn't about not doing something. That's a deficit model. It's about what healthy people do, and healthy people are able to create resource states that they can associate into whenever they need to tap into these empowering resource states. This might be an example of one of Lazarus's empowering assignments. Most of the clients who I work with, who I give week 3 assignment to, focusing on developing emotional intelligence, really find it helpful and beneficial to them. The fourth lesson, or week 4, is about detaching from negative emotions. Now notice, it's not about not having negative emotions. Let's try something here. As you watch this video course, right now, close your eyes for just a minute. Close your eyes. You're getting CEO hours with the eyes closed. That's really pretty cool. And probably in your pajamas too. So with the eyes closed, think about anything you want to on the planet Earth except a yellow Jeep. Do not think about a yellow Jeep. Think about anything else you want to, but do not think about a yellow Jeep right now while your eyes are closed and you're sitting in the chair watching this video. Okay? Now go ahead and open your eyes. Open your eyes. What were you thinking about? You were thinking about a yellow Jeep. If you try not to think about something, you have to think about something in order to not think about it. This is the paradox of any thought suppression techniques. In fact, I was reading a journal article just the other day about discredited psychological therapies, and although it was at the bottom of the list, there were a number of professionals who felt that thought-stopping techniques were in fact, to a large extent, discredited techniques. I know why. I wouldn't say they're discredited, in my own opinion, but I think that they are appropriate probably only for a very small minority of clients. For the vast majority of my clients, instead of helping them to not be depressed or not be angry or not be anxious, what I want to do is teach them how to break cognitive fusion. I want to teach them how to separate themselves from their thoughts and from their feelings. I don't want my client to not have thoughts or not have feelings. Then they would be a human doing rather than a human being, at least according to John Bradshaw and some of the books that he's written. By the way, some of you have also heard that quote on South Park. The original source is actually not Kenny from South Park. It actually is John Bradshaw from the 1980s. But I want my clients to be able to have their thoughts and to have their feelings, but not follow those things, not become engaged or enmeshed or create cognitive fusion with them. And the week 4 assignment is about detaching from negative thoughts and negative feelings. It teaches a specific skill so that your clients will be able to do this and practice this, getting better and better at it each and every week. Week 5, or the 5th assignment or 5th lesson, is about creating autonomy through inner confidence. Ideally, we know that we're good therapists when our clients no longer come back to us. Well, think about it for a minute. The ultimate goal, this is the only profession where if we do our job right, we're unemployed. Ultimately, we want our clients to be able to function autonomously and independently apart from therapy, or at least we want to be able to reduce the intensity of the level of care or service which is being provided to that person. One of the ways to do that is to help our clients develop an inner confidence. And the homework assignment in week 5 is something I do with my clients who come sit here in my office. And it's going to be a useful tool for you in working with your clients. I'm going to expand on each of these 5 assignments, explain a little bit about them, the foundation of why I do what I do, and what the assignment is. And the first assignment, homework assignment, focuses on developing mindfulness. Now, I recognize that a ton of therapists have taken a lot of mindfulness training over the past decade. Courses from people like John Kabat-Zinn at University of Massachusetts, people like Stephen Hayes, who has incorporated mindfulness into acceptance and commitment therapy, or like Marshall Linehan, and incorporating mindfulness into dialectical behavioral therapy. And a lot of people, a lot of therapists really understand the value of teaching clients mindfulness. What they don't have are 2 resources to do it on a practical level. Resource number 1 is a non-religious explanation of the psychology of mindfulness. And the video that I've prepared for your clients so that they can learn about mindfulness is a non-religious video talking about the psychology of mindfulness and the importance of staying fully in the present. And I teach them in this short video how they can in fact enhance their own mindfulness as a tool for stress reduction, as a tool for anxiety management, and as a tool even for pain control or dealing with other areas of life where mindfulness has demonstrated efficacy. The second component of this is the MP3. This is our shortest MP3. It's a little bit under 3 minutes, and it's simply a daily practice in mindfulness. This is something all of my clients have on their phone, and I ask them to do this once or twice a day with intention, each and every day between now and their next session. Now, for those of you who are not yet familiar with mindfulness, you will enjoy the client education video that comes with this course that you can, of course, provide to your clients. And you'll learn how to utilize mindfulness from that short video in your own life as well. You'll also benefit from actually doing the assignment that you ask your clients to do. I have found that I am a much more effective therapist when I actually do the same assignments in my own life that I ask my clients to do in their life. But mindfulness, the research shows us, accomplishes a number of different things. First, it decreases rumination. How many of your clients, in common language, wallow in their misery? They're enmeshed with what's wrong, what's not okay. They ruminate about the past, or they ruminate about their future fears. Mindfulness is an effective tool for reducing mental rumination. My addicted clients ruminate about their drug of choice, whether that's nicotine with my current clients or my past clients who are alcoholics, heroin addicts, and benzodiazepine addicts. Mindfulness is a tool for stress reduction. The University of Massachusetts has a Center for Mindfulness-Based Stress Reduction, and it is a program which is utilized across the country, an 8-week training program in a number of different oncology centers to help people who have a diagnosis and are experiencing treatment of cancer to decrease stress during this time. Mindfulness is a great tool for improving memory, enhancing focus, and decreasing emotional reactivity. Now think about the clients who you work with. How many of them are having problems because they're emotionally reacting to what's happening in the world around them and the other people in the world? As a licensed marriage and family therapist, this is probably one of the chief problems in couples counseling. So even a mindfulness training tool can be useful as a homework assignment in couples counseling. Clients who are taught mindfulness have greater cognitive flexibility, and the research shows, as I just mentioned, they're able to enhance their relationships. Mindfulness, the research on mindfulness, and I love how well the idea of mindfulness has been researched. Don't go to google.com, go to scholar.google.com. When you go to scholar.google.com, you will only get results from academic journals, peer-reviewed publications, academic textbooks. It's a tremendous resource. And type in mindfulness and really just about any problem that you work with, and you will probably find empirically based studies demonstrating the efficacy of teaching mindfulness-based stress reduction skills to clients. These include, in the literature, pain control clients, eating disordered clients, ADD and ADHD clients. In fact, I have a CD that I give to a lot of my clients that I created a few years back on mindfulness meditation for attention deficit disorder and attention deficit hyperactivity disorder, impulsivity, marriage counseling, anxiety, personality disorders, depression, and many other commonly treated conditions in therapy. By the way, I do use the word with my clients in my office, mindfulness meditation, when they understand that meditation is a non-religious concept. Then they are certainly happy to participate fully in the process of mindfulness. In the patient education video that I prepared, I simply use the word mindfulness and teach the skill of mindfulness without any references which may confuse them. Mindfulness is not a new idea. It's a new idea to us in the world of therapy, but that's because psychology is new. It has been utilized for many centuries, for really thousands of years, is an idea to help people live fully in the present. Because by living fully in the present, we can actually enjoy life. In fact, there's a famous quote. Many people recognize this quote from Master Oogway, that was the turtle, in Kung Fu Panda. But apparently the real source of the quote is not Kung Fu Panda. The real source of the quote is actually, according to the research I've been able to do, Eleanor Roosevelt. She said it first, or at least it's been attributed to her first. And that quote is, "Yesterday is history. Tomorrow is a mystery. All we have is the present, and that's why it's a gift." What a marvelous quote. And that really is the heart of mindfulness. John Kabat-Zinn says it's about paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Marlett and Christopher, in 1999, in their book on mindfulness, said it's about bringing one's complete attention to the present experience on a moment-to-moment basis. I work with a lot of clients who have a fear of flying. They have flyophobia. They're corporate executives. They've been transferred to a new position. That new position requires they travel a lot, they fly a lot. They're freaked out about it. They're either going to have to quit or they're going to have to see me and overcome their fear of flying. And mindfulness is one of the chief strategies that I utilize with them to help them to minimize their anxiety in situations where they feel distress. Notice, I don't try to get them to give up their distress. That's a futile battle. Instead, what I have them do is live fully in the present, literally breath by breath, because ultimately the bottom line, especially if you're afraid of flying, is as long as you're breathing, you're actually okay. As long as you're breathing, no matter what the plane is doing, you're actually okay. So mindfulness keeps a person living fully in the present. It's an excellent strategy for decreasing anxiety, not because we try to eliminate the anxiety, but because the experience of being fully in the present is, like Eleanor Roosevelt said, truly a gift to our anxious clients. The audio file that comes with this course is, like I said, a short 3-minute video. The teaching video that you can provide to clients explains mindfulness. It goes through a brief demonstration of mindfulness. I answer some common questions about mindfulness, and I teach them how this can be a useful skill to them. The MP3 is something that most of my clients have found to be of particular value, and something that you're going to find to be of particular value in the work that you do with the clients that are on your caseload. The second assignment that I provide to clients, and these aren't in order. I mean, sometimes with one client I do this, and with another client I do this. Some of my clients get all 5 of these assignments. Some of them get 1 or 2 of these assignments. you can choose to structure it like I do in any way that's beneficial to your clients. But the second assignment that I often give to my clients is the assignment to develop and practice therapeutic relaxation training. Now, my very first experience with therapeutic relaxation training came about in my very first job in inpatient psychiatry in about 1988, 1989. And I was actually a graduate student at the time. I got a job in inpatient psych, and I remember Mary, one of the blue-haired nurses at the time who worked second shift with me, she came up to me and she said, "Why don't you have a relaxation group every night? It would really benefit the patients. They're pretty stressed out." And so she gave me a cassette tape of Autogenic Training. I didn't recognize then what a gift she had actually given to me and to my career. But I went and listened to it with the clients, and it was amazing the response they got listening to this cassette. Now, Autogenic Training sounds fancy, but auto, of course, means myself, and genic means, from within. So it really means autogenic means generating from within. And it's a process of therapeutic relaxation that was developed in 1932 by a German cardiologist named Johann Schultz. Now, it must have been difficult to be a cardiologist in 1932. This was before we had Plavix, before we had, stent surgery. It was before we had, heart transplants. So being a cardiologist in 1932 was pretty rough. And basically, this doctor's patients were all dying. And so he thought to himself, there's got to be something I can do to help their heart be healthy. So he came up with a protocol of relaxation training called Autogenic Training. I don't hear this taught or talked about too often in the world of psychology. However, remember, Mary, the nurse, gave it to me. And in nursing, if I go look at nursing journals, I'll find that much has been written about the value and the usefulness of working with clients in the area of autogenic training. So the homework assignment that I provide to my clients actually teaches them a basic strategy for autogenic training. Now, Johannes Schultz had a specific 8-week protocol for guiding his cardiology clients through this. I actually do, with some of my clients, take them through literally that same 8-week protocol of building skill sets upon skill sets for those whom autogenic training would be a primary intervention. But for most of the clients I work with, the simple week 1 strategies for autogenic training, creating physical changes in our body. Really, much of what we know about biofeedback actually came from Schultz's ideas, and self-regulating the body. And the week 1 assignments that he came up with are what I primarily use with my clients to help them create new experiences from within that can help them relax into a state of decreased stress, decreased anxiety, and increase their own ability to self-regulate their own bodies. That's really important as a therapist because we often have physical responses to the emotions and the thoughts that we feel and experience. Now, along with autogenic training, another strategy in relaxation training is progressive muscle relaxation. Many of you are probably familiar with Edmund Jacobson's protocol. It's sometimes called Jacobson's progressive muscle relaxation. And in 1928, Edmund Jacobson described his protocol of tensing and relaxing, tensing and relaxing. And he identified 16 different muscle groups that we could guide a person through using a protocol that helped them notice the difference between tension and relaxation. Herbert Benson in the 1970s wrote a book, Harvard psychiatrist wrote a book called The Relaxation Response. Progressive muscle relaxation has been well researched as an evidence-based protocol, something of specific value to the clients that we work with. Well, because I want compliance from my clients, I have created short learning sessions for my clients covering the basic strategies of both progressive muscle relaxation and autogenic training, and I've combined them. So in the video presentation for clients, I go into some of the hallmarks or reasons why we would practice progressive muscle relaxation, how it could benefit them. And I teach them a little bit about autogenic training and how simple a process it really is and how it's actually been demonstrated to be helpful and useful. And then the audio session, this is our longest session. The first one, mindfulness, is our shortest. The autogenic progressive muscle relaxation session is, I think, about 9 minutes long. And it's something that they can listen to on a daily basis or on a not daily basis when they're feeling physically stressed. I mean, you can choose to assign it to your clients as you see fit. But I like my clients to develop a daily practice because then they can work towards a point where they can engage in these things without an MP3 guiding them through it. They will intuitively know how to calm their own heart rate and create smooth and rhythmic breathing, autogenic training, when they're angry or stressed. They will intuitively notice the difference between tension and relaxation and say, wow, I'm getting tense. I should probably relax. And so I use progressive muscle relaxation and autogenic training often together with my clients. And the MP3 that I've prepared for you to give to your clients is a short, brief version. I use passive muscular relaxation rather than an active protocol like Jacobson in order to keep it short. But you'll find that this increases compliance, and by increasing compliance, we increase our clients' benefit. The third homework assignment focuses on emotional intelligence. Now, you're probably familiar with emotional intelligence because Daniel Goleman wrote a best-selling book. It was topped the New York Times list for years on the subject of emotional intelligence, and also another book on social intelligence. I know a number of therapists have read his book, but he wasn't the originator of the idea of emotional intelligence. As a matter of fact, it was Howard Gardner at Yale University who came up with the idea of multiple intelligences. Now, this was a tremendous relief to me. I don't know if you ever have this experience, but do you ever worry that you're not as smart as other people? My son is absolutely brilliant. He got a 35 on the English portion of the ACT. He got a 34 overall score on the ACT. A darn near perfect score. That's awesome. But my son, for the past 18 years, has been correcting my punctuation, my capitalization, my spelling. He's been correcting my pronunciation. He's been correcting every aspect of how I communicate using either written or verbal language. He's got a natural gift for it. He's an excellent student, and he's at the top of his class. And he far exceeds, in his linguistic abilities, any linguistic abilities that I have. And so every now and then, here I am being corrected by a 18-year-old kid. As a matter of fact, when I was doing my doctoral work, and he was, a sophomore, junior in high school, I was actually having him proofread my dissertation. I had him proofread my other, assignments and those sorts of things. So here he was, a high school kid, double checking the doctoral students' work. And every now and then, I'll think about him and I'll think about me, and I'll think, wow, I'm just not as smart as other people. Well, there's good news. And the good news is that in a meta-analysis that was done by Judge Colbert and Illes, they found that the relationship between intelligence and leadership, I'm interested in leadership, I'm involved in educational leadership, and I think that counseling is actually a leadership process. So the relationship between success as a leader and intelligence is actually considerably lower than previously thought. What a great relief to me. I don't have to be super smart to be an effective therapist. But there's actually good news. And the good news is that Howard Gardner's work at Yale University says that the only way to measure intelligence is not through an ACT score. It's not about only math or only English or only science or only whatever other ways we measure academic achievement or our IQ, our analogies, the Miller analogy test. I had to take that to get into graduate school. Our ability for abstract reasoning, etc. What Gardner actually tells us is that there are a number of different ways to measure intelligence, in addition to the traditional IQ or intelligence quotient. This includes linguistic intelligence. My son has an aptitude towards that. Logical or mathematical intelligence. I do not have that either. Musical and rhythmic intelligence. Interesting. Never thought about that as intelligence before. But this is about recognizing and being able to manipulate a variety of different patterns, particularly as it relates to sound. What a great tool for an engineer. What an awesome form of intelligence for an engineer. We, of course, have bodily or kinesthetic intelligence, according to Gardner. And this is about somebody who's able to produce from within their own body, ranging from crafts to athletics. And I have to admit that I've learned a tremendous amount from my personal trainer at my gym, who, by the way, does not even have a college degree. Doesn't have a college degree, but man, he is highly intelligent in this area, and he's taught me about a lot more than exercise. He's taught me a lot about life as a result of my visits with him. Another form of intelligence, spatial intelligence. This is really important for a pilot or a rocket scientist. Proprioception, knowing where we are in relationship to the rest of us at all times. Another form of intelligence that Gardner proposes. And we have a naturalistic intelligence. I have a friend who actually in the Dallas area, he calls himself the world's only prestidigitating comedian herpetologist. And he goes to all of the grade schools and he teaches children about reptiles. So he does, instead of a magician who produces a rabbit out of the hat, he prestidigitates and pulls a snake out of the hat. And he's funny, and kids like humor, and they learn to like reptiles. And he has served as an expert for a number of different schools and organizations because he has a natural intelligence. Gardner also talked about interpersonal intelligence, self-awareness. This, I think, relates back to mindfulness. And all of these forms of intelligence are areas that we can help our clients increase their acuity in by providing therapeutic homework assignments. Two other forms of intelligence that Gardner identified are the two forms of intelligence really that Goleman ran with. We have existential intelligence and interpersonal intelligence, and of course out of these come emotional intelligence and the idea of social intelligence. According to Goleman, the definition of emotional intelligence is the capacity to be aware of and to control and to express one's emotions and to handle interpersonal relationships judiciously and empathetically. Now think about that for a minute. If your clients had emotional intelligence, if they were able to do an assignment, just like a kid can do a math assignment to get better at math, to have the capacity to be aware of, control, and express one's emotions, and to handle interpersonal relationships judiciously and empathetically, wouldn't you want to give that assignment to your clients? I want to be able to do that. Goleman tells us that there are 4 components to emotional intelligence. There are probably more, but these are 4 things he identified. Self-awareness, knowing why we feel and what we feel. Self-management, which involves effectively handling distressing emotions, but I think overlooked, and more important, the ability to generate positive emotions. The third aspect of emotional intelligence is empathy, being able to see our connection to other people and how others are feeling, and then skilled relationships, combining these abilities in a meaningful way. In order to help my clients with acuity in this area, I often give them assertiveness training assignments. I feel, want, need, blank. I know that many of you watching this video teach your clients assertive communication. I have a workbook that I wrote many years ago called the Getting Along Workbook, which teaches assertive communication. I often give my clients written assignments from there. In the lesson that I provide to our clients in this particular course, what I provide is an assignment in regards to self-management, specifically generating positive emotions. Your clients already know how to create negative emotions. Chances are they probably don't have any experience or practice in generating positive emotions. There's an old saying, I heard it many years ago, you have the same pants to get glad in that you have to be mad in. And although that's one of those old cliche sayings, you might see it on a barn house sign somewhere at an antique store, there's really a lot of truth to it. But for our clients to do that, to take control over their emotions and not only modulate difficult emotions, but to create positive emotions takes skill. So the assignment provided in this actually goes through a process of helping them to identify and create resource states, then to amplify those resource states, and to take those resource states or those positive emotions with them. This is probably one of the more powerful assignments in this series. And if you don't have experience in working with your clients in this area of emotional intelligence, I encourage you to do this assignment yourself each and every day for a period of 1 week. And you'll find that when the week is over, the same thing that your clients find, an ability to generate positive emotions in any place, in any situation. Assignment number 4 focuses on relational frame theory, although I don't call it relational frame theory in the patient education video. Those are words that are really meaningless to my clients. Relational frame theory is something I could actually spend a great deal of time talking about. It's sort of the missing link between behavioralism and cognitive behavioral therapy. It's something that Stephen Hayes, the developer of acceptance and commitment therapy, has focused much of his research on at the University of Nevada, and it's something that I think is really important. Relational frames are the mental or the subconscious structures we have that support an idea, a belief, an experience, an interpretation, or an action. When you think of a tent, go ahead, think of a tent. When you think of a tent, you're probably thinking of the canvas. And that is a tent. But it's the aluminum tubes that are the frame supporting it, holding it up and making it the experience of the tent. Otherwise, it's just a pile of canvas without mental constructs. Ideas are just ideas. Experiences are just what is, and feelings are just feelings. And so, what makes us angry? It's the frame that we've created that makes us angry, for understanding anger. Anger means different things to different people. And this is because of the relational frame, the subconscious construct the client has created in their own mind to support that idea. One of their, let's use anger as an example, relational frames that they have created is, anger means I'm sad, or anger means I'm hurt, or anger means I have to get revenge, or anger means I'm worthless, or anger means I'm righteous. Have you ever bought one of those watches that has different colored bezels, interchangeable bezels, and different colored bands? It's the same watch, but you can actually change the watch to look completely different by changing the pieces. And that's really what relational frame theory is all about. It's about the mental constructs where we place our experiences. These mental constructs are often arbitrary, they're often subconscious, and in fact, they're also learned. And as easily as our clients can learn these things, they can unlearn these things. And when we teach our clients to unlearn these things, then what they're able to do is detach from difficult emotions. They're able to experience difficult emotions without ascribing meaning to it. Let me give you another example. Here's an example from ACT therapy. A fish does not know that it's swimming in water, because that's just what fishes do. They swim in water. They've never not swam in water. They don't know that there are things out there that don't swim in water. Their world, this is just normal. And people, you and I and our clients, what we swim in is not water. We swim in our thoughts. Okay? And because we swim in our thoughts, we're always thinking and we're always creating arbitrary relational frames. We're always trying to make sense out of something and put it into some kind of context. The problem that our clients have is the context that they put it in is often self-defeating or unhealthy. And so the week 4 assignment is about helping our clients to break the artificial relational frames that they have created that support their ideas which have been unhelpful to them. This is, again, one of the powerful assignments in this course, and I think that you will find a lot of value and utility in using it with your clients. Lesson number 5, you can be more confident. Here's a great example. How many of you who are watching this video are already more confident that you will be a more effective therapist and have the tools and resources that can help your clients to experience change? Now, do something for me for a minute. Close your eyes. Again, it's pretty cool to be able to get CEUs with the eyes closed and in your pajamas. Just don't fall asleep. With the eyes closed, breathe in, breathe out, and pay attention to that feeling of confidence. Observe it. Check it out. Ask yourself, what does it feel like to be a more confident therapist? Feels pretty good, doesn't it, knowing that when you go into your next therapy session, you'll be able to say to a client, even if you're limited by managed care and difficult resources, hey, I have an assignment for you that I think would be real helpful to you. Here's where you can access it. And here's how you can practice it each day for the next week, and here's what the outcome of that practice will be. Breathe in, breathe out. Pay attention to your breath, this moment, and notice in this moment you are already more confident. Check out your posture. Is it already a little more elevated, a little straighter than usual? Is there even a smile on your face as you know that you've done something by participating in this course that'll help you be an exceptional therapist? Awesome. Allow yourself to be confident, to be a confident therapist, to associate into a state of confidence. Go ahead and open your eyes. Back to getting CEUs with the eyes open. But notice, by doing something specific, taking this course, you were able to become more confident. And then, in the last 1 minute, by really taking time to observe that confidence, you were able to associate into it or amplify it or experience it at a greater level. That is pretty awesome. The 5th homework assignment that we're going to give our clients is a homework assignment that focuses on the value of confidence and helping them to build confidence in any situation. I use some visualization techniques here that my clients really love, especially my clients who have to step into situations where they need confidence. My clients with social anxiety, my clients who might have a fear of public speaking but be called on to do that, my clients who have played a passive role in a relationship with somebody who's been playing an aggressive role, and the assignment through the MP3 and the teaching session through the video is really empowering to most of the clients that I work with. Now, my hope is that by participating in this course, you have learned how to utilize homework assignments with clients in a way that is going to be effective for the clients that you work with. I think that you are going to enjoy viewing the 5 videos that are available to your clients, as well as listening to the MP3s that are available to your clients. When you do what you ask your clients to do, you will in fact become an even more effective therapist as well. I'm very happy that you have participated fully in this program. To earn your CEU certificate, there's a link below. Now, you can't generate a CEU certificate until you view the other remaining videos and listen to the MP3s and understand them, and then of course come back and earn your, complete the questionnaire to earn your CEU certificate. It'll automatically be generated to your email box. If you have any questions about this course, you have any questions about anything, please ask me at my forum. You can go to changeworkforum.com. I am more than happy to answer any questions about this course or the ideas in this course. And you can always email me as well. Again, thank you for participating. I'm Richard Nongard with Peachtree Professional Education, and I wish the best to you and to the clients who you work with. Please check out some of our other resources for clients in mental health, marriage and family therapy, and addiction counseling as well on our website at fastceus.com.